Greetings, everyone, and we're really happy to be here. Again, this is Dr. Eugene Zamperone, Dr. Z, usually here with the natural nurse. She's taking a break today, and I'm the host of this wonderful program talking about health, wellness, and issues in alternative medicine today. Remember, you can always find out more about our books and some of our great herbal products and podcasts and things like that at naturalnurse.com. And Dr. Z Naturally. We're having a trip to Chinatown coming up soon. Should be great to immerse ourselves in understanding traditional Chinese medicine. You know, for those who like to go to Chinatown in New York and shop, there's a whole other side of Chinatown that's interesting, looking at the ancient medicine. And so that's coming up in September, and all kinds of great trips and things like that. So we're happy to be here, and we have today a very interesting guest, a practicing dentist in Staten Island who specializes in the treatment of sleep apnea as it pertains to dental health, and her name is Dr. Marcia Green. And again, she runs Bayview Dental, and we're glad to have her on to talk about how a correct dental approach can support those who suffer from this issue, sleep apnea. I'm pretty knowledgeable in it, too, from a naturopathic perspective, so it should be an interesting conversation. Stay tuned right here. Dr. Marcia, are you there?
Yes, I'm here. Good morning. How are you?
Oh, great. Thanks a lot for joining us, taking time to educate our listeners about dentistry. You know what, Dr. Marcia, people think that the mouth has nothing to do with your body. I don't know how that kind of happened in medicine and dentistry. Maybe it goes way back in history. What's your thoughts about that?
Misconception. It's the way we were trained. Originally, dentists were trained in barbershops back probably 1800s or before. The earliest dentistry was done in like a barbershop type situation. And as it converged with medicine somewhere in the early 1900s, the teachings were separated. So they separated the head and neck from the rest of the body, not realizing that everything happens and everything starts in the mouth or the digestive system, and it's all connected.
And that just seems to, folks like you are trying to turn that around to show that there's a big connection between that. I know one of my students in the College of Naturopathic Medicine in Bridgeport, she did a great thesis on the link between oral pathogens and autoimmune disease. So there's so much learning about the flora of the mouth and the nerve centers of the mouth.
All the diseases in the mouth really are systemic diseases, especially periodontal disease, which they used to treat simply as a dental component. It is not. That's how I started on this journey of naturopathy and dentistry. Patients would come in with periodontal disease, and you would see a certain pattern, and you would do the dental work, the scaling, the root planing, which we're all familiar with. However, that patient, when you check 2 years later, would come down with some type of cancer. And particularly in women, I was seeing a pattern of breast cancer or leukemia based on what we were seeing in the mouth, and it was not responsive to dental treatment, to the basic dental treatment that we were taught. So just through research and trial and error, realizing that, yes, you have to look at kidney disease, liver, and just basic inflammatory processes in the body. And it shows up in the mouth as one disease, but it's really one disease in the entire body.
Yeah, thanks for that. It's interesting. So now, I know you work with a lot of kids with sleep apnea that have some type of sleep disordered breathing. Can you define that for us?
Right. Sleep disordered breathing is basically a decreased airflow through the respiratory system. So you'll find some children, they can't breathe through the nose, so they're called mouth breathers. If a child is a mouth breather, it means they don't have enough room in the mouth for the tongue, so the tongue becomes enlarged and they feel like the child is suffocating. So they'll either stick a thumb in the mouth or the tongue is pushing through the teeth. and I know you've seen these children where the teeth they have what we call an open bite. The tongue just pushes straight through, and the lips go with it. So these kids are trying to breathe. So of course, when they sleep at night, the tongue falls to the back of the throat. And these kids are what we call airway deficient. The airway is narrowed. So from the nose going through back into the lung, the airway is narrowed, so the kid is not getting enough breath. So they're always panting. That leads to, of course, your cognitive deficiency. They're not getting enough oxygen to the brain. They have an inflammatory process, and it leads to a few different things in children. Obesity, their ADD, ADHD factor is a component of sleep-disordered breathing. So there are several factors, but those are the main ones that they're obese and cognitive deficiency and the ADD, ADHD components.
I noticed that, I remember when I was in school, we were looking at pictures of children that had this particular malady, and their actual shape of their head would change, so it would affect even the cranial bones.
The cranial bones that's where somebody who's doing craniofacial therapy would come in. It's a multifaceted treatment, so we're jumping a little bit ahead. But yes, look at the neck is a little bit more slender, and the head has a different shape. And if you look at the eyes, the dark circles under the eyes almost look sunken in. And that's just looking at the children, you could tell there's something going on. You're not really sure what it is. And you just have to not take a guess, but there's certain parameters that you test and follow. You look at the tonsils. You look at various components of the oral cavity. And
yes, I've seen the adenoids be very enlarged.
Right, send them to for a sleep study. There is pediatric sleep study, so we can watch and see the sleep patterns at night, what's going on. And from there, the dentist won't make the diagnosis, but the medical doctors do.
Yeah, so we've taken people off of a lot of different foods and seen some improvement in their lymphatics. And what are the tonsils and the adenoids? What type of tissue are they?
It's mainly all epithelial tissue, but the tonsil it takes in it absorbs the toxins or bacteria that before it gets into the digestive system. So it's really phagocytic, if I can remember that term. It will pull in bacteria from getting into the stomach before it gets into the stomach. And the adenoids is just an old, what we call ancient part of the anatomy that really isn't needed anymore, part of the respiratory system. But the tonsils, if they become enlarged, if you're not getting enough air, they absorb a lot of bacteria that become inflamed. If you're mouth breathing, because if you're nose breathing, the air is passing through the nostrils. There's nitric oxide in the follicles in the nose, correct? And as the air goes through, it's being cleaned, or there's nitric oxide is antibacterial. So it's being cleaned as it goes into the lungs. So you're getting clean air going into the lung. If you're breathing through your mouth, there's bacteria in the mouth. It's going right into the tonsils, and the tonsils become overinflamed. And it doesn't go in, it's not going into the normal place. So you're getting inflammation all the way to the digestive system. Hence, a lot of stomach issues with children who are mouth breathing.
Yeah.
And the allergies, it's all connected. The allergies, the food allergies, seasonal allergies, and they're on all kinds of medication. So you have to start with diet.
And lifestyle, yes, that's very true. Wow. So just a simple thing like, eating the wrong foods and having some problems with the tonsils and adenoids, or being chronically stuffy and inflamed, can then lead to all these problems. All these problems,
and it's all dentally connected. So they really need to see, they're seeing the ENTs and the physicians, but they really need to some part in there see a nutritionist and a dentist who's focused on airway treatment.
So how would you go about working with these types of children? Like, let's break it down for us.
With the children, usually the moms would say, my child isn't breathing right. The kids who come in, we see our children from, let's say, 2.5 to 3. and we do an assessment. Once a kid can listen to verbal commands, if they stick their tongue out and I can't see the tonsils, I know that, there's something called a Mallampati score, if you know anything about that. So if you stick your tongue out, you can see the tonsils, that's a good thing. If you can't see the tonsils, it means the tonsils are usually enlarged or the tongue is too large for the mouth. And based on certain criteria that I see on the children, we will screen them for airway. There's an x-ray that you can take a look at that, but in an older children, not in a 5-year-old, it's a little bit much. But the physician, the ENT, can definitely assess airway in the children. But
and then what do you do?
We have, there are dental appliances that can be used. If I see a child that has a narrowed palate or what we call a vaulted palate, or the child has a thumb or tongue-sucking habit, there are appliances, dental appliances that we can use at that age to widen the palate so the child can breathe better. And we teach them exercises to help them to breathe. Just teach them how to breathe a little bit slower, a little bit longer breath, and they don't really hyperventilate. And that, believe it or not, will open the airway without drugs.
And you said that this problem leads to kids with behavior problems.
Yes.
Try to explain that again to the listeners, because maybe they're not making the connection.
Right. If they're what we call these children not breathing deep enough, so they're getting less oxygen to the brain over a long period of time. Combine that with probably some kind of nutritional deficiency. They're not absorbing the nutrients. They may be eating correctly, but the stomach is now affected because it's taking in bacteria through the mouth and not through the nose. So the stomach is upset. So the lining of the stomach is having issues. So they may be having some issue with like I said, nutrient absorption in the lower gut, and that affects the brain function. And we're feeding, our foods, unless we get really organic foods, kids now are very sensitive to the chemicals in some of the foods.
And you said that they're not getting enough oxygen to the brain
because of their breathing issue. It usually starts with an airway issue. And that is where the ADD, ADHD comes in, and it's shown in the research. If we start the kids early enough, it's three components: nutritional, behavioral modification, and a dental appliance. So they have to see not three different therapies, but the therapies have to be combined, and we have to assess and do certain things and see what works.
So describe this type of dental appliance that you might use. What does it entail, and what is it like?
Right. We could do something called a palatal expansion. There are certain appliances that are silicone-based, and you put it in the child's mouth, and as the child grows, we're expanding the palate with the growth. So that you change your appliances, a series of maybe 2 or 3 appliances between 5 and 8 years old. And we're doing really pre-orthodontic treatment before the child reaches 12 years old. Because if you wait until they're 12, there's a certain amount of growth that has taken place, and the palate is already hardened. So you can't make too many changes. If you make the changes between 5 and 8, you will have way more benefits in terms of getting the proper shape and form of the jaws and the teeth. And there are a few companies that make them. There's a company, I don't want to name companies, but there are a few companies that make appliances that you can apply to the teeth very early and get the results. But
and does the child wear them all the time, or just sometimes?
Yeah, they wear it 1 to 2 hours a day, and they can sleep in it once a child understands and they're wearing it. It's called myofunctional therapy, myo meaning muscles and functional. So you're training the muscles to be more proactive with the tongue. And I'll flip back a little bit. If you remember, maybe in the 30s and 40s, women would breastfeed a lot more, right, than they're doing now. So when a child is breastfeeding, they're using different muscles to really shape the tongue and the palate, and they're really getting more of a workout. Now, once you get to the 60s, 70s, 80s, no one is breastfeeding anymore, at least not in America. we're not breastfeeding. So the kids don't have that developmental muscle anymore, that firm muscle. The tongue goes up to the palate. Everyone now has a low tongue. And as the tongue drops down in the mouth, the lips are weak. They're not getting the suction firmness that they would from a breastfed child. So
plus, of course, all the other benefits of kind of breastfeeding, like the
right.
colostrum from the mom and the.
That's correct. But we cannot tell moms, and I'm not advocating that moms should breastfeed. I'm just saying that's one of the reasons why kids are having so much malfunction in the oral cavity, because we can't replace Mother Nature.
Now, the conventional approach to people with kind of breathing disorders is to get like a CPAP machine and things like that, but that doesn't seem like it's doing much to solve the... It's almost like a Band-Aid approach. Am I right?
Right. The CPAP machine, it's basically CPAP means it's positive air pressure into the cavity, into the respiratory cavity. It's like a reverse vacuum cleaner, kind of. It puts the air in. It doesn't do anything for the dentition, for the teeth. It does allow people to sleep who are severe sleep apnea or severe obese. They really need to have a CPAP initially. It should be a combination of treatment. Like I said, you may start out with a CPAP, but a CPAP, in my opinion, should not be forever. And people don't comply with a CPAP after maybe the first 6 months. So that's really a dangerous thing, especially in somebody who's severe OSA. They really need to continue with it. But there should be a dental component where they have a dental appliance placed in the mouth along with the CPAP, and then wean the patients off the CPAP, because you're going to go to a lifestyle change, which is what your show, I believe, is about, is to reduce dependency on any appliance or any external modality, as we say.
Yeah, exactly. That would be somewhat what we would be looking for, making all these changes like you mentioned. But I guess, like you mentioned, there's a time when there's such low oxygen flow that we have to use heroic measures sometimes,
is
right?
Absolutely necessary, and it's been around for a while, but now we have other modalities, and we understand OSA a little bit, obstructive sleep apnea, a lot more than we did, say, even 20 years ago. So if somebody is morbidly obese and they're on a CPAP, you want to prevent them getting a stroke. So you absolutely use a CPAP, but you have to look at the dental component. And the reason why we look at dentistry, patients who come in with several fractured teeth over and over, and we're doing root canals, post-cords, and crowns, which most people are familiar with, after one or two, you should be looking at a sleep study and saying, maybe there's something going on here. Patients are grinding the teeth because they're trying to breathe. It's a breathing issue, not necessarily a dental issue. So we have to move back a little bit into the medical and assess the patient more medically. That's where the sleep study would come in, and then get the three components on board to treat that patient. So the CPAP would not be the end-all and be-all, and, CPAP for life should not be the end-all and be-all.
Right. How does weight have to do with all this, Dr. Green?
Well, if you're overweight, of course, you're definitely not breathing. You're not getting enough oxygen because the tongue is enlarged, the muscles are weak. You're not breathing correctly. So definitely you would be your airway would be pinched off in the neck. And if someone is like 17, I think it's 17 and a half inches, beyond that, it's considered obese, and that person definitely would be a candidate for a sleep study and more likely a CPAP. And our country's facing a serious crisis in obesity right now.
So the weight somehow translates as, actually, you said your tongue is enlarged and the muscles are weak?
When you sleep, the tongue falls back to the back of the mouth, and you closes off the airway. And you increase the inflammatory process because the body is not taking in enough oxygen at night. When you sleep at night, your body should be at rest, correct?
Mm.
And when you're breathing correctly, there are cells in the brain called the glial cells. So the brain technically will clean, those glial cells should clean the brain. If you're getting enough oxygen enough oxygen is going into the tissues, the body will clean itself. right, during the night, if you're really getting a good restful sleep. If you're not getting good restful sleep, you're not breathing correctly, the body's toxins will stay in the body. They'll stay in the brain. It stays in the blood. So your body is more acidic, therefore becoming more inflammatory. And you have
so those are signs of not getting enough oxygen.
That's right. You get a chronic inflammation in the body overall. All your morbidities increase, your comorbidities, your high blood pressure, your high cholesterol, heart disease, all of them increases. So sleep hygiene is really what we need to be looking at in America to reduce our medical cost across the board.
What about snoring? That's a big problem too. It's even a problem with couples, and one has to sleep in another room.
Marital problems.
Yes, yes.
Snoring is maybe your first indication. It's not an indication necessarily of apnea, but it is a sleep disordered breathing issue. So if someone is just snoring, have it checked out, and there are appliances that can be used to just work on snoring. But I would recommend a sleep test or just see an ENT to see what is going on, why is the person snoring. And there are anti-snore devices on the market. You could purchase them over the counter, or you can see your dentist or your physician and have something done. But snoring, it is an indication, and depending on the degree of snoring, like I said, some people sleep in separate rooms because someone snores so loudly. I wouldn't take that too lightly because patients have not woken up. Husband and wife has a routine. Somebody sleeps in another room, and one morning you wake up, the other person doesn't meet you in the kitchen. And that's a scary prospect. So if somebody's really snoring and it's that loud, the bed partner doesn't get enough sleep. So their health is affected.
Yeah.
The wife or husband is not sleeping because the other partner is snoring so loudly. You're irritable the next day. You're having different issues, but it's a problem for the couple overall. And
so they say that of course losing weight helps, but you're saying that it's a lot has to do with the shape of the mouth as people gain weight.
The shape of the mouth, right? The anatomy of the mouth to start with. That's how we start with children because it really starts in the anatomy that we get from our parents or, genetically. So we have to look at the shape of the palate, and it can be corrected as an adult, but it's easier to correct it in children. So that's why I focus more on children. But definitely losing weight, getting on a healthy lifestyle, reducing the amount of, I wouldn't say carbs, but just changing our diet to suit a good lifestyle, a healthy lifestyle. And for everyone, that's individual. I don't tell people to eat meat, not eat vegetables, not eat carbs. I think everyone ethnically and depending on where you live, what's available, what's your economic strata, to find what's comfortable for you, what foods you enjoy, what foods are healthy. And the weight should come down. But weight is a factor of information. So you want to work on keeping a healthy lifestyle, and the weight should really come down, unless there's a hormonal factor, a different factor why that weight isn't coming off, such as thyroid or something like that.
Tell us a couple of cases that you've had really good success with, like starting with children and then, say, adults that have some type of sleep disordered breathing.
Yes, I've used, like I said, we use different companies, different appliances from different companies, and I've been treating children for maybe 10 years, and I would send you some pictures, we've really gotten to change its facial growth and development. So once you get that child in at 5, 6 to 8 years old, and we can get them to wear the appliances, it is amazing. They will tell you they breathe better, they feel better, their allergies go away. They're just healthier children based on breathing. And this is nothing new. It's just been around. There's Dr. Boyteko years and years ago who started that. And it's used to train athletes in different modalities. With the adults, it's a little bit harder to do and to get the results. But once we expand the palate on an adult and they find that they can breathe better or they're not grinding the teeth anymore at nights, different scenario. I just started working with nutrition, but I put a doctor in to work on the nutritional aspect because it was too much to do at one time. And also patients don't comply when one person is doing all aspects of the treatment. So we've engaged a medical team to do the full scope.
And so what would the nutritionist look at? They do like a diet survey, or how would they work this patient?
They would look at what the patient is. First of all, we get an assessment of the weight, what they're eating, what's the lifestyle, and run the blood test, find out what the cause is, what's their cardio, set up an exercise program for them, and work with them on just getting a proper diet in for that particular patient. And supplements. Some people need supplements, some people don't. It just depends on what you can get them to do for 3 months. We're in New York. We don't have a long attention span. We put patients for 3 months just to get some results within the first 3 months. I think they do well.
Interesting. Well, we're going to take a break now and play a natural medicine chest and some station IDs. Again, if you've been listening, we're listening to a very interesting discussion with Dr. Marcia Green, and she's a practicing dentist in Staten Island, and she's talking about the importance of dental health and sleep apnea and how the correct dental approach can support those who suffer from these issues. In the second half of the hour, we'll ask Dr. Green some more questions about dentistry, maybe preventing periodontal disease and some other aspects of her practice that she's interested in, because I think we've talked a lot about the apnea. And so we'll take a break now, and we'll be back with more of the Natural Nurse and Dr. Z, so stay with us.
You are listening to PRN, Progressive Radio Network.
On this edition of the Natural Medicine Chest, we'll discuss sarsaparilla, or Smilax officinalis.
Sarsaparilla is a tropical plant which grows in South America, Mexico, and Guatemala. Although most Americans are familiar with it as a flavor enhancer for root beer, it has also been used for its beneficial properties for hundreds of years by many different cultures. In Roman times, the young shoots were eaten, and the mature vines were worn as garlands at festivals of Bacchus. According to ancient Roman writings, sarsaparilla originated when the beautiful maiden Smilax was turned into a shrub after her love was slighted by the young crocus.
Sarsaparilla was brought to Europe in the 16th century by Spanish traders. A French physician, Nicolas Monardus, published a comprehensive account of sarsaparilla as a treatment for syphilis in 1574. During Portuguese military operations in 1812, a British Inspector General of Hospitals noted its positive effect on syphilis patients. It has also been used in China for treatment of the same condition. Sarsaparilla was included in the United States Pharmacopoeia until 1950 as a recommended treatment of secondary syphilis.
Sarsasparilla's medicinal action appears to be a result of binding bacterial endotoxins in the gut, thereby decreasing their absorption. This greatly reduces the stress on the liver and is likely responsible for its historic use as a tonic and blood purifier.
In a controlled study of 92 patients published in the New England Journal of Medicine in 1942, a chemically active component of sarsaparilla called sarsapanin greatly improved psoriasis in 62% of the patients and resulted in complete clearance in 18%. Sarsaparilla is often recommended by naturopathic physicians for gout, arthritis, and psoriasis. Another folkloric use for sarsaparilla is as a tonic for male sexual potency.
So, if you want a root beer flavored tea with a long history as a healthy tonic, reach for the sarsaparilla in your natural medicine chest.
This is Karen Hartglass, host of It's All About Food, and you're listening to PRN, your source for progressive, up-to-date, and inspirational information on nutrition and health.
And we're back with more of The Natural Nurse and Dr. Z. I'm Dr. Z. And remember, you can always get information on our walks and talks and different things that we're doing, myself and The Natural Nurse, by going to naturalnurse.com or drznaturally.com. We have interesting things going on in the fall, like our Chinatown trip, and in March, our trip to Jamaica, learning about ethnobotany and cultural medicine. So, yeah, send us a message, and also suggest some guests. If you have an interesting guest or book that you read on holistic medicine and things like that, we'd love to have the author on and maybe have a great show with them right here at Natural Nurse and Dr. Z on Progressive Radio. And with that, we bring back our guest. That's Dr. Marcia Green. She's a DMD and a practicing dentist in Staten Island, and she's discussing how dental health, including sleep apnea, really is systemic health, and how the mouth has so much to do with things that maybe you didn't even ponder and know about. Like I even learned stuff too listening to the show. It's great having guests, interdisciplinary guests, and learning about their experts and specialties. Like I didn't know that the tongue gets enlarged in certain people, and it makes sense. It's a muscle, and if you're flabby, the tongue gets flabby. And it's interesting. I've seen that from a Chinese medicine perspective. That has to do with weakness of the qi, which you would think if you're out of shape and not eating right and have bad nutrition, that your qi becomes weak, and then the muscles become weak, and then the airways pinched off, and you basically sleep 8 hours a day, and that means for 8 hours you're not getting enough oxygen into your body. Talk about problems. That's really interesting, and how it does lead to many systemic problems, things that we don't even think about. But we do in alternative medicine. That's what's nice about our guest. She's tying in dentistry, which we all have to go get our teeth cleaned, we hope, and take care of our mouth. But it's more than just for chewing, right, Marcia?
That's correct. The teeth are for chewing, and it's more than cosmetic dentistry. Interesting, you're going to Jamaica. I'm from Jamaica, so.
Oh wow! Really?
I may just join you on that trip.
Oh yeah, you love it. Yeah, we usually go to St. Mary up in the St. Mary area, so it's beautiful.
I grew up in St. Mary. I grew up
really?
in a farm. Yes, so I know a lot. My grandparents were, they did herbal medicine. We didn't go to a regular doctor, so.
Yes, we learn all about taking our course. When you go to Jamaica, you learn probably about 60 plants that's used by traditional healers in Jamaica. Everything from cerasee to sarsaparilla, like we played on the Natural Medicine.
I just heard that. I grew up on all that stuff. I know all of it.
That's great.
With it. Yeah.
Well, thanks for joining us again. So we talked about snoring, and it's more than just a marital thing. It really has implications on health and wellness. And now we want to talk about grinding of the teeth. That's also a problem that a lot of people think it has to do with stress, unresolved stress at night. What's your take about grinding on the teeth?
It's a behavioral problem. In the children, grinding it's a breathing issue. The palate, like again, the size of the tongue versus the amount of space, or what we call the box. The palate and the jaws just they're not wide enough. We're not chewing hard foods anymore. If you look at people, like I said, look at Europeans who came here maybe in the 20s, first, second, third generation. By the time you get into the third generation, you need orthodontics. The first generation, when they came, they had wide jaws, like we call a wide face or a brachial-type face. They were wide, round jaws. As we got into industrial age, we chew less hard foods, less natural foods. So our jaws have become smaller. The teeth have become more crooked because they don't have enough room. So everybody's getting their wisdom teeth out now. So we're grinding because we're not able to breathe properly. It's a breathing issue, not necessarily dental issue, but that we're grinding and it's showing up as grinding and broken teeth and more dental work. But we're not getting enough breath, so that the body is subconsciously telling you, I need to breathe, so we clench down.
Dr. Weston Price did lots of work on that. People can look at you go on YouTube and see the journey of Dr. Weston Price. Dr. Price was a dentist, and he traveled the world to look at,
anatomy, different faces.
Anatomy of the jaw. And I know he wondered why people eating a fairly low-carb, native diet, so to speak, a natural diet, had big jaws, and as they got away from that, he noticed actual changes in their face.
That's correct. You look at like I said, go back and look at if you could get a hold of your great-grandparents, your grandparents, your parents, and you and your children. Totally different. I've been fortunate to be on Staten Island for 32 years, and I have grandparents, parents, and children. I'm getting grandchildren now. But you could see the difference in the teeth, and you're doing more orthodontic work earlier. And I have a population they're immigrants, bad word these days. But my African patients, solid, broad jaws, broad face, all the teeth fit and line up. Their children now all need braces because they have an American diet, softer diet, more processed foods. They're not chewing naturally hard foods anymore. Same thing with the Caribbean population.
So that chewing changes the muscular structure, changes the jaw, widens it, and allows the teeth to fit.
All the teeth would fit in. Everybody's getting their third molars out now.
Is that generally what's done in orthodontics? It's like instead of making the jaw bigger to fit the teeth, they're extracting teeth to kind of put them in a smaller space. Is that true?
That's the paradigm has shifted somewhat. There are two different train of thought on that, and I don't want to get into a controversy. There is you extract teeth to close the space to allow for all the teeth to fit in. Where myofunctional orthodontics comes in is if you grow the face with a child, and you do these appliances that allow the teeth to fit in as the child is growing. So you put this silicone appliance in very early, between 5 and 8, and we keep changing the sizes. And as the child is growing, the jaw is spreading out wider and wider, and all the teeth will fit in. So by the time the child is 12 or 13, they have a fully functional jaw, and teeth are all aligned, and they don't need traditional orthodontics as we know it. So that is the paradigm shift in people that are doing this myofunctional treatment. And there's a handful of people doing it. Traditional orthodontics, they wait till a child is 12 or 13 and they won't intervene. That's just a matter of training and what people are looking at. Like I said, I've been fortunate to have been in a general practice and have been able to it was just something interesting to me that we could treat children earlier, and I got into it, and it works. So you don't have to do that. But grinding is a big factor. And I'll go back to 9/11 in New York, and I think most dentists will attest to this. We had more patients with fractured teeth right after 9/11 than probably in the history of our careers because of the stress. People were just clenching, and their teeth would break in half, literally. So we had a lot of dental work for about 2 years just on broken teeth.
And that was because of, people having stress even at nighttime, right?
Yes, from the shock. And I've seen an increase in that. I don't know if it's 9/11, we're 15 years post 9/11, but within the first 2-3 years, teeth would break. You would see a patient the week before 9/11, and they would come back in with 3 teeth broken. Some needed to be extracted, some needed root canals, people needed implants. So a lot of dental work was done just from that factor.
What types of foods do you find that some of your patients are sensitive to, which causes swelling of the turbinates and become a mouth breather? Is it the typical dairy and wheat that you would think of?
Dairy is number one. I think dairy with children, there's a lot of sensitivity to dairy. The gluten factor I've not gotten into as much, but children are just sensitive to everything. I don't know. I feel sorry for parents these days They're sensitive to from dairy to different carbs, different breads. I don't know what they would feed the children. I don't know what they're eating.
Yeah.
Other than people don't like vegetables, but it's a big challenge. They're sensitive to everything in foods. I'm like, well, what do they eat? So we're trying to, even fruits, they're sensitive to, you said, well, make the kid a smoothie, use blueberries. Well, they can't do that. I'm like, I don't know what to tell you. You have to get nutrient-dense foods for this child. You have to figure it out.
Have you done any work with the flora of the mouth? And so here's the big controversy. A lot of dentists give out things like, mouthwashes that kill all the flora, good flora and bad flora. Is there any new research on the horizons of, probiotic rinses that would then establish?
Yeah, there's a big push now for probiotics specifically for the bacterial flora in the mouth. I try not to give my patients, I will suggest stuff, but we try not to give them anything. Like I said, people are so sensitive to different things. You really need to have someone who's focused on nutrition to look at the gut flora to begin with. So I think if you change the gut flora, everything else falls into place. So we need to look at what is the patient eating and get that gut through probiotics, increase water. People look at alkaline water, that kind of stuff. I would just getting the body, getting the gut flora in balance. And once that comes into balance, everything else flows from there. The health will change. The person's health will change overall.
What's the big cause of periodontal disease in this day and age? Because I think that leads to, people think, I just take out the teeth and get a bridge or implants and things like that. And of course, you need that at that stage. But the goal is to, of course,
to
prevent periodontal disease. So what's your advice as a more holistically minded dentist?
Right. Periodontal disease is again a factor of a systemic disease. And so when, as an adult, there's two different factors. There's one called juvenile periodontitis, which is what you would get in your early teens or 20s. They're predisposed because of an immune issue. But as an adult getting periodontal disease or gingivitis, part of it is diet, part of it is an inflammatory process in the body. So again, if you're reducing inflammation in the body and reducing the stress on the teeth as far as grinding, the periodontal disease will decrease. The risk of periodontal disease will decrease.
I know they've drawn some interesting correlations between certain bacteria in the mouth and heart disease. Can you tell us a little bit about that?
It's always the same bacteria in the mouth can feed the heart. That was the first link that was picked up. It's now heart disease, diabetes, and Alzheimer's. But again, it's all a gut flora that has to be changed, and it has to do with the Streptococcus bacteria, which is in the mouth, but out of balance will cause a factor, disease, any disease. So again, you want to get diseases, the bacteria in balance. So you would use the probiotics and water, maybe your vitamin D3 is a big factor, but it depending on where the patient is. So I would always encourage a patient to get a blood test to see where they are before they start any nutritional products.
Right. It's important to know
you need a baseline.
What they're lacking. If they're what I've seen is in my practice, I've been practicing for over 30 years myself too, and what I've seen is that people are low in some of the minerals that help us foster antioxidant support, because we find with these inflammatory diseases that there's a higher amount of what they call matrix metalloproteinases. These are enzymes that dissolve and loosen the periodontal ligament and cause loosening of the teeth, and then there's also resorption of the bone. I was surprised to read that periodontal disease is really partially a type of osteoporosis. I was like, wow, that makes a lot of sense, but I don't know if a lot of doctors think about it like that.
They're not thinking. They're thinking osteoporosis is something you get in your 70s or 80s. Osteoporosis, if you see it in the mouth, is starting very early in your 20s. Like I said, people with juvenile periodontitis, if you look at them in their teens, they're prone to osteoporosis. So you would start a preventive program, which most people aren't going to listen to you in your teens and 20s, that, I'm going to get this, I'm going to get that. But it's showing you a health profile 50 years out. So if you see someone periodontal disease, you want to get them on a program. And I say this to people, you may be pre-diabetic. It takes 10 years to show up in the blood test. When I'm seeing a bone pattern, bone loss in your 20s or early 30s, I'm saying you may want to look at your changing your diet, looking at diabetes as a sub-health factor, and also heart disease, because this is coming down the pipe. My whole family is diabetic and hypertensive and heart disease. So I knew very early in my 20s to start to work on a basic diet to not have diabetes. I'm way past 50, but I don't want to have diabetes, so I've worked on it for 30 years.
Yeah, the high consumption of carbohydrates and
sugars,
which of course dentists have always been telling folks, make sure you're not having a lot of the refined or other types of sugars to induce cavities and things like that.
We were worried about cavities, but the sugar in the diet now causes it raises the oxidative level of the body, right? So you're getting more inflammation. So everything starts with an inflammatory process. So if you can reduce the amount of sugars that you add to your diet or that's in the foods you eat, you're going to come out a little bit better.
Yeah.
But if we eat foods in our naturally occurring state, like I said, I grew up in Jamaica, so when you went for an orange, you picked an orange. It had nothing on it. You picked fruits from the farm. It was natural, fresh fruits. You're going to be better than if you're getting food that's sprayed with a chemical that you can't remove, and you don't know what's in this chemical, and you're eating that for years and years and years. So we're prone more in North America to some other stuff that are left unseen. And it's sometimes unknown, and we just can't remove it from the foods. It's in the soil, it's in the food, so we just have to be a little bit more judicious, a little bit more careful.
Now, what about hygiene? That's a good place in our last few minutes of the show here. Hygiene is so important. I mean, it goes way back to ancient Ayurvedic times where they believed in, doing things like oil pulling and certain hygienic practices with the mouth that people have, they maybe brush, but they don't do other things. So what would be, in your opinion, being a dentist trained with a lot of experience, what would be a good hygienic protocol that patients can follow? The best types of toothbrushes and the best types of things. Yeah.
I said easy. What I like the water flosser. I think Philips is a company that makes a water flosser. They have them. People don't know how to floss. And some people don't have the dexterity to floss. So I said, get a water flosser, use it at night to get all the particles out from around the gums. And now everybody has a battery-operated toothbrush or an electric toothbrush. Just use it. If they use it, I think they're just better off. It doesn't matter which toothbrush. They have these charcoal toothbrushes. That stuff is ancient technology. It's not really technology. It's been around. That's what some cultures use. That's all they had.
Yes.
So they want to use natural bristles. Right. They want to use advocate a toothpick, but you want to use natural bristles or you want to use an electronic brush because of dexterity, especially with the seniors. Go ahead and use a water flosser, and some of the water flossers do come with a brush, one of those spin brushes. Just use that. Keep the teeth clean, keep the teeth healthy. I'm big on vitamin D3. I'm big on antioxidants to use, either make it yourself or a lot of companies now are making a package with a good antioxidant package. Every day do something to advance a healthy lifestyle. So every day take a dose of antioxidants. I take it or make it yourself if budget is a factor. Blueberries, strawberries. You can make, there's a lot of recipes around. Make up yourself with one of those blenders a nice little cup of antioxidant mix and drink it. Drink whatever you like. Or take a set of vitamin D3 or whatever it is that you work out with your doctor or you've read. But do something on the antioxidant level to increase your chances of good health.
Yeah, because that, like you mentioned, that reduces inflammation. Antioxidants are best.
That's the key. The key to
cellular fighters against inflammation, right?
Right. Your key to life is reducing the amount of inflammation in the body, in adequate water, detoxing the body. People are now doing fasting. That's been around to do fast, and not just for religious reasons, but to give the body a chance to breathe and to rest, to give the cells and tissue a chance to rest and breathe a little bit better.
I certainly enjoyed our conversation. We covered a lot of things that relate to the mouth. It's just, I think there's some really interesting information out there, and people have to remember that the mouth is connected to the rest of their body, and it requires as much care as we do when we work out and we do things like that. A lot of people they forget about the mouth. They just think it's not super important, maybe for cosmetics, but that's about it. So that's a big thing I can see in your practice and philosophy that you'd like to change in the thinking of many Americans, that's for sure.
Yes, we just have to get people on a healthy lifestyle, and we're all doing some part in getting people to understand what's important. It's not such, we all look beautiful, we live in New York, but staying healthy and being a contributing healthy member of society, we can help. People are just ill. There's a lot of illnesses, I think totally unnecessary. We're supposedly a first world country, but we're not healthy as healthy as we could be.
Now, how could people reach you if they want more information about your work?
I am on the website, Bayview Dental at BayviewDental736.com, or my phone number is up at 718-273-8686. I don't have a book yet. I'll work on one, but basically at the website. And I would love to join you in Jamaica. I'm definitely going to follow up with you on that.
Okay, great.
Yeah.
Well, that does it for another edition of The Natural Nurse and Dr. Z. We're really glad that you took the time to look at your health carefully, and particularly this time we looked at the health of your mouth and how it relates to so many things. Who knew that, obesity, snoring, all these things like that had to do, breathing problems affected your brain, other types of changes in the body that relate to inflammation. The mouth is so important. Actually, I could leave with a historical fact that Benjamin Rush, who signed the Constitution, and although he believed in things that we don't believe in, like bloodletting and whatnot, but he cured a man of arthritis by removing an infected tooth.
Wow.
And that was the first, and you talked about Bright's disease and the link with streptococcus and things like that. So we know that the mouth is so complex, and we don't have to diss it in this day and age. It's a big part of the body, and the health of your mouth, it's a barometer for your whole body health. So that does it for another edition. Thanks, Dr. Green, and
thank you
we'll
so
see
much.
you next time. You're welcome. Have a great day, and stay healthy, folks. This is Dr. Z signing out. Bye-bye.
Okay, bye-bye.